We all know that India is facing a COVID relapse in the form of its second wave, which is more infectious among the lower age groups, and this unexpected surge is putting the health of people at risk amid shortage of oxygen cylinders, which is the inevitable source to save lives now. But people might wonder, how come the cases are going this far if the restrictions were already at an ease since January? And why India, being one of the worst hit nations, not prepared for something like this? Did we always lack in the oxygen beds, in ventilators, or the cylinders? Let's find the answers to those questions in the next 4 minutes. There's a theory that this variant emerged in Amravati of Maharashtra that caused the huge surge in nearby cases in February only. There are over 240 mutations found in India so far of this COVID-19 virus that is doing rounds in Bengal and is increasingly being called as a triple mutation. The Bengal strain, which is also dubbed by scientists as something which is capable of escaping a person's immune surveillance, even if the person was earlier exposed to a virus or vaccinated.
Very positive thing that we are seeing over here is that people are wearing masks over here. This is a very healthy sign that is being seen right now. What we do see, at least over here in Kolkata's Sham Bazaar market area, that people are, however, no matter even if they are getting out, they are wearing masks. Majority of them are wearing masks, which is a very positive sign.
So, is it really the Amravati strain or the Bengal one that scientists need to research about? But the current situation, the prevailing situation, is so brutal, which shows the lack of leadership and resource management from the government side on so levels. It's scary how some oxygen supplies in the hospitals are left for the nick of time.
Folding disaster. A patient who's hardly breathing is brought in. To get past the shortage of beds, they've packed in stretchers, wheelchairs, as many as they can. But the first line of treatment against COVID-19 is oxygen. And they've almost run out. At this point, there is just 1 hour of supply left.
Hospitals from Delhi in particular are doing their extra hard work to regain the situation of patients with low oxygen levels. A team from Pentamed Hospital in Delhi sent their vehicles to oxygen plants of Bahadurgarh and Bhavana but were delayed due to long queues.
One medical shop, we found people with empty cylinders waiting to buy their own supply for loved ones who urgently need it.
On Sunday morning, Delhi's Fortis Escorts Heart Institute, which has at least 100 patients on oxygen support, said it would not admit any more patients because of lower stock. 25 people died on Friday night at the Jaipur Golden Hospital in Delhi due to the shortage of oxygen, and even Gangaram Hospital has alarmed for the shortage of oxygen 4 times in 24 hours. You might already know that the situation in the country is already very critical. The havoc in the national capital is wrecking the families, their hopes from the government, and our health institutions' ability to revive the hundreds and thousands which could have been saved if there were resources.
The capital is being ravaged at a frightening speed. With every pyre that burns, India's self-belief is dying. Each funeral is a story of personal loss and national shame. Charanjeev Malhotra has been helping to cremate the dead for decades. Now, he barely ever stops working.
It devastates every young mind who lives in India, who had voted for their current governments, who were promising to be there for their people. COVID-19 deaths are going undercounted, which boasts of countries' underpreparedness, not the lethal virus which has been there for over a year now. This underreporting can also be a political agenda, according to some analysts like Dr. Mukherjee. who cited the very public scandal in 2019 when Mr. Modi's government tried to suppress data showing a rise in the unemployment rate. There can also be a tremendous pressure from the central government on the state governments for projecting progress when it comes to COVID data. Despite India being world's leading vaccine manufacturers, less than 10% of Indians have gotten even one dose. The struggling campaign aims to vaccinate broader aid bars from May 1st, but now, due to the country's stark vaccination shortage, there are ban on exports. This shows how much mismanaged we were while we didn't save enough for our people before exporting to countries. And now that US is being considerate for their own citizens first and would want to store their raw materials for any lethal COVID wave in future, we question their loyalty. And here we are not supporting any enmity, but questioning this worsening condition of our health infrastructure. If we do not question right now, there will be around 8 to 10 lakh cases and 4,500 deaths per day. And the estimated peak time, according to Chief Economic Advisor, is in the third week of May. So while there is still some time left, we can just request the government to curb this unending flood of deaths as soon as it can.